and Brad, the two most famous physical therapists on the internet.
Great to be alive, Brad.
Oh,
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together,
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about sciatica, herniated disc. Should you do cardio exercises for pain relief? And we're going to show you exercises to avoid.
Right. There's a lot of people, Bob, that they want to do cardio. That's been their exercise of the past for, weight control, cardiovascular, and they just feel better doing it. So you get a herniated disc, sciatica. What can you do?
What can you do?
Right.
We actually got this question from quite a few people. We do listen to you. We always want to, hear your suggestions below because we are trying to compile them now.
Yep.
And then we do the ones that we hear the most.
Sure.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Join us on our social media channels. We're always doing a giveaway. I don't know what it is right now because we did this one earlier, but if you go to like the description of our YouTube channel, or if you go to Facebook, it'll be on there. At some point, you'll find it on one of our social media channels. We're giving away something great.
Yeah, we give away things from mattresses to
Thermatex and
the breather.
The neck.
Well, let's
pillow.
get on with the program.
Let's get on with the program.
Okay, so here we go. Sciatica, that's referring to pain, numbness, tingling that runs down your leg, oftentimes past the knee, down into the foot even. The further down the leg, the worse it is. If you're in a flare-up with sciatica down to the leg, these exercises, then even cardio is probably not going to be an option. If it's not so bad, yes, and if you have it on and off.
Well, I would try it. I mean, because if you're having pain down below the knee and you try one of these and it actually feels better,
sure,
which it does sometimes,
right.
Then you definitely have the green light.
Sure,
to go.
We're going to take it cautiously at that time.
Yes, exactly.
But there's number one rule about any of these exercises. Actually, whether what you do is if the pain in your back and the leg gets worse or it goes further down the leg, stop what you're doing. I mean, this could be anything from the exercise or just sitting with poor posture.
I know that sounds really elementary, but that's really true.
Right.
I mean, it's like the old thing, if you're hitting your finger with a hammer and it's hurting, stop hitting it. Well, it's the same case here. I mean, if it's going to hurt and make it worse, you can't do it. If it feels better, you can do it.
Right.
Simple as that.
Right.
And we kind of know which things tend to make things worse.
Right.
To make it worse.
And that's what we're going to go through. So with sciatica, probably the most common cause of it is from a disc problem.
Right.
The disc is bulging or herniated, putting pressure on one of the nerves that run down into the leg, and that's why the symptoms and the pain, numbness happen down the leg. There are some other possible reasons.
It could be piriformis, it could just be inflammation.
Right. You may have stenosis, but we're going to take what we see as a general and give you some information on that.
And generally, the position that's going to make that disc worse, that herniated disc worse or bulging disc, is a slouched or rounded out posture like this.
They call it lumbar flexion.
Right.
Typically.
So what cardio thing? Let's talk about the first thing to avoid, Brad. Which cardio exercise tends to put you in this rounded out position?
Well, I'd say riding a bike.
There we go. That's exactly right.
Particularly road bikes, where they're trying to get as aerodynamic as possible. Because I'm a road biker. I know I got aero bars and all that.
Yeah.
And it really, unfortunately for you bikers, it's not going to be good for this problem.
Right. So you're going to want to avoid bicycling, even stationary, when you have. Now, it's possible if you had the seat way up and you're really in good posture, it's possible. But
I know on my bike, I had my bike custom just winter time to get my handlebars up higher, so I'm not bent over so far. And not that I have serious sciatica, but I'm not going to gain any speed, but I'm more comfortable.
That's how my bike is. I don't bike serious, but I'll during the summer I'll do some biking every day. And if people laugh at me because I'm tall and I have it way up like this, so the neighbors literally laugh at me.
You should get grape hanger handlebars that go up like this.
That would be funny.
Ape fingers.
Yeah.
Anyways, so let's go to some things that you should do or can try. Oftentimes walking. Walking on a flat surface. If you're on a treadmill, do not elevate it like you're walking
Right.
uphill. It needs to be flat. If you have a fancy treadmill that goes downhill, you could try that to a degree. But again, remember the rule, how your body responds to it.
I always remember this, Brad. Actually, I had a fellow therapist. Actually, he was a partner in a different practice I had at one point, and he worked in a back clinic for years.
Sure.
And all they saw were back patients. Number one thing they first had him do is they started him walking.
And on a treadmill, I'm assuming?
Just like if someone came in and they were really limping around, he'd make them walk around the room.
Sure.
Like just start walking.
Okay.
And it's funny how you get increased blood flow to it. You're starting to work on better posture.
Mm-hmm.
It's a good thing to try.
Now people might want to run, and we were discussing this before the video, and we're kind of up in the air on that. It depends on how you respond. If you're jogging or running, and
you're getting some pounding.
Right, yeah.
And if it's a disc problem, it could make that disc problem worse.
So, if you're thinking, if you're a 4-foot runner where you don't have as much pounding.
4 foot, not 4 foot tall. You're on the 4 foot.
Right.
On the front of your foot.
I'm glad you clarified that,
You're
Bob.
a 4 foot runner, short runner.
And don't try it by going out. And, if
Right.
it feels good the first mile, I wouldn't run 3 miles.
That's right. I would try that 1 mile that day, see how it is, that,
for the
that
rest
night.
of the day.
Yeah, that night.
And the next day.
Right.
If it feels good the rest of the night and the next day, that means you can add on 10%.
So I was telling Brad, when I get back pain, and it's not sciatica, I always run the next day.
Right.
And it always feels good.
Right.
It just gets more blood flow. It's getting things
Right.
moving.
It's not sciatica, so that's
that's a different story.
It is,
Sciatica is
yeah.
a different story. You got to really be careful.
And now elliptical, anything that puts your back in an upright position kind of endorses good posture.
And it's
promotes
low
it.
impact too.
Right, low impact. But again, I'm not going to tell anyone if you've got sciatica, you can run your elliptical for 30 minutes because typically cardio people like to go 30 minutes or longer to get the benefits.
You're experimenting is what you're going to do.
Exactly. I know with mine, I was having sciatica. It wasn't from a disc. However, when I started on the elliptical, very consistently, 20 minutes, I'd start getting
You start
pain.
to feel it. That was time to stop.
Right. And that was a few years ago. Now I can do it as long as I'd like to. So things have changed with me.
Sure.
So, this can happen with you as well. Nordic track. Now that's nice. Or cross-country skiing.
So like a cross-country ski simulator.
Right,
The
yeah.
Nordic track. I don't know if everybody knows the brand name.
Right.
but,
It's kind of a thing in the past now. We're dating ourselves.
Yeah, we are.
Where you get in both hips extend, and so your back extends. And when the back is in that lumbar extension versus that flexion that we talked about, oftentimes that's going to promote a good disc position.
Right. So
along with the circulation.
It actually could be helpful.
Sure.
It could almost be, serve as a treatment.
Yep.
Again, if you go back to rule number 1, you don't have increased pain.
And again, time length. Don't go out and go forever. An hour long when maybe you don't want to start at 20 minutes and see how your body responds. This next one, swimming. Non-weight bearing, you get to work the muscles. Again, there are some times where I've had people swim, including myself, where swimming irritated.
See, that's what I was
my
just going to
back.
ask you, Brad, because you've dealt with your spondy for many years now.
Yeah.
What is there a certain thing you can always do? A certain stroke you can do, or is there?
That's a good question. I mean, some people, if you just take an exercise class where you're not swimming laps, but you're actually doing exercises
In the water?
Right. You're going to have to really pay attention to how your back and leg feel. Because it's non-weight bearing, there's a good chance you're going to tolerate exercises in the water a lot better. But not always. So just keep the number 1 rule in mind. If you are doing laps, typically the crawl, the normal overhand swimming is going to be good. Now, if you're twisting your body, I know because if you want to do it right, your body's going back and forth like this. That can irritate the back a little bit because you're putting a little twist on there. The breaststroke, now that's a nice one. It does arch the back.
Sure.
And the backstroke, that one,
should be fine. Huh?
Should be fine, but you're gonna have to be careful. One of them I'd really probably stay away from is the butterfly. which is probably not a big deal because not very many people
will do it.
It's a
Yeah.
pretty advanced stroke and it's very aggressive.
Sure.
So things to avoid for sure. I do want to hit these. We talked about bicycling. The next one is the rowing machine.
Right.
It's a really good cardiovascular exercise, but it really is hard on the back, particularly if you round your back, which you have a tendency to do, even
Yeah,
if you.
even if you think you're doing it correct.
Right.
If somebody watches you that with a trained eye,
Yeah.
you're going to find out you're
Right.
probably not doing it
Yeah.
correct.
And this next one, we've had other videos on
Yeah.
this, is burpees. The full burpees where you go down like this and up.
Yeah.
That really puts a lot of stress on the low back with sciatica. Avoid that one.
Yeah, I'm not a big fan of burpees, to be honest with you, just for the back alone. I mean, I maybe going to get some people mad at me again.
Yeah.
You don't want to get the yoga people mad at me again.
You don't hit that.
They're still
Yeah,
upset at me.
Yeah, you hit that nerve. Wow. Sorry
all
about
right.
that one.
Well, remember, Brad,
Yes.
we can fix just about anything.
Except,
A broken heart.
there you go. But we're working on that. You know, we got to get through the sciatica first, and then we got to get through the neck, and then, but we've got those well under control.
Broken starts with a B, though. You think you should hit that first before?
Oh, Bob, we're going to
Oh,
forget about that alphabetical stuff,
All right.
chronological, all that.
Thanks.